Happy Wednesday, everyone. We're here with CEO Cindy Siler from Mercy Community Healthcare, and we just have been talking about Find Hope Franklin, and so she's going to talk us through some of the things that Mercy and how they're connected with that. How's it going this afternoon?
Oh, great, great. Even though it's cold, I love this weather. I love the sunshine.
Yes, the fall. Fall
Yes,
is always a great time of year.
yes.
So let's
This-
talk about Find Hope Franklin. You know, the city of Franklin mayor has rolled out this new initiative. Well, not relatively new, but we've been talking about it for the last few months. And so tell me how Mercy decided to join in on the Find Hope Franklin initiative.
In the very beginning, actually, isn't it crazy that we say pre-COVID and post-COVID
Yeah.
or middle COVID? But in the very beginning, when Mayor Moore called me, he called it a blue ribbon task force. And actually, it was just a group of us that sat together to talk about the increase of mental health needs for mental health services in this community, and not just Franklin, Williamson County, surrounding county, and that is Mercy service area, and we do provide mental health services. So he involved me in that group, and I was honored to be there with so many of the leaders, Mindy and Amy Alexander, and so many of the leaders that have been a part of that. And we included some school folks
Right.
because it is such an issue with the students.
Mhm.
Um, and so we just sat and discussed in the beginning, and then we had I'm sure you've already had this conversation with many people, but we had a strategic plan. We had a facilitator to come in and actually help us walk through what can we do. And the immediate goals were, let's get some money to do QPR training. So we make our community aware and of the high need for the services, the high suicide rate, honestly, that existed. And then we further made some goals so that eventually, are we looking at some kind of crisis unit to really help the police department? Deb Faulkner was part of that group, um, in servicing our community well, and our first responders,
Mhm.
and how that what they have to deal with. So it was exciting, and then the group has grown and grown, and now we're in a situation where we meet regularly. The website has been developed and is under the Refuge Center, and I've got Stephen Neely from my staff, who's over behavioral health services, that also comes to the meetings, and we really work to educate this community. We've even had the little dream that at some point we would be a QPR city that would
Mm.
be like the first that would have put that as such a goal, that we would um, really uh, put it in the forefront of our community.
Mm. You mentioned services a few times. Can you tell people what's mental health services that Mercy Community Healthcare offers?
Sure. Um, in the very beginning, when Mercy started as Mercy Children's Clinic, it
Mhm.
was very soon recognized that not only do these children need primary care, just preventative primary care services, but that there were behavioral health issues that were involved. And so very early, they hired Jonathan Boyd to start a behavioral health program. And that started with counseling, and it grew into what is now our patient and family support. They hired Dorothy Bullard to actually come on and put together and develop a whole patient and family support department that would provide services beyond mental health and primary care, to sort of integrate those services so that we take care of body, mind, and spirit. We provide counseling services in our counseling center. We have 12 to 15 full-time counselors that do marriage and family counseling, individual counseling. We have groups for adolescents and certain specific high need groups. We've got a Lego group for kids.
Oh,
Um, and then We also provide psychiatry. We have 6 psychiatric nurse practitioners and a psychiatrist that supervises their work and also sees patients. Anne Futrell, she's amazing. And then we provide in the counseling center parent and child interactive therapy. It's an evidence-based therapy that actually has the parent and the child in a play therapy mode, and the parent has an earbud, and the therapist is in another room coaching that play to help the child with behavioral health. And if I go a lot past that, we use EMDR and some other modalities that I would want someone that is the professional in that area to describe. But we do the full gamut of behavioral health therapy
I
at
think that's
Mercy.
one of the great things about Mercy Community Healthcare, and you guys have done this since the beginning when it was just Mercy Children's Clinic. You always offer an integrated look at healthcare, which I think is unusual, and it's not often found, which I appreciate.
Thank you, Donna. One of the things that we pride ourselves on, proper pride, is that part of reflecting the love and compassion of Jesus is just that the person is body, mind, and spirit. And Dr. Gibson, our chief medical officer, is often quoted as saying he can take care of the body, he can do heart, lungs, and all those pieces. But when someone is in the room with their primary care provider, that's often the moment that they decide to disclose suicidal ideation or deeper depression. They also disclose homelessness or not having enough food for the evening meal or transportation issues. And so that's our place, is to do body, mind, and that spiritual part of taking care of the whole. We call it the healthcare hug that Mercy
Mm,
can give.
I like that. I don't know if I remember that, the healthcare hug. We've talked a lot about mental health and all the things that you guys offer. What would you say is the biggest need right now in mental health care?
Well, just the fact that there's more need in the community than any of us can provide. Amy Alexander and I talk a lot about the waiting list and the fact that most mental health services, psychiatric services, require a cash payment, and many insurances might pay for a few EAP programs, pay for a few counseling appointments, but beyond that, that doesn't care for the person and the need that is there. So the fact that we all have waiting lists, and you can't wait for care when your mind is hurting.
Right.
And so that's the biggest problem, is just trying to spread out our services enough to care for everybody that is in need.
Mhm. You've told us so much and it's so much to take in. And I know as people wait, is there some ways that you think that maybe we can take care of our mental health, things that we could do on our own while we are seeking out help from others?
Well, obviously, the self-awareness and the self-care that all of us should do and that we don't is all of those issues that are physical and mental. Get enough sleep, allow yourself to say no, take care of yourself. The old adage that you have to put the mask on yourself, the oxygen mask on yourself on an airplane, fits everywhere. You can't take care of your family and others if you don't pay attention to your own mental health. And obviously, prayer, spending some time with our Heavenly Father is always a moment. But the fact remains that just like you have strep throat, you may have depression. And so, seeking someone for help, someone to talk to, someone that is a professional in that area, is the right thing to do always.
Yeah. Well, I appreciate you taking time out. If you guys want to learn more about this, we have a whole article that published today where Cindy talked us through all these points we just went over. And it talks about, if you want more information, you can find that at Mercy. So thanks again for joining us.
Thank you so much, Donna, for the opportunity. I appreciate you and how you do this so well.
Thank you so much. All right, you guys go check it out. Find Hope Franklin. There's a whole page there. It gives you all the resources for the area that you're is available to the community.
Donna, could I say we do need to be very appreciative in this community for a mayor that has seen the need and wants to do something about it. That's very unusual, and we're blessed.
Yes,
Yeah,
yes.
thank
The
you.
fact that he took this on and created that is pretty amazing.
Yeah. Thank you.
All
Thanks a
right,
lot.
thank you. See you soon. Bye,
Take
everybody.
care. Bye-bye.